And good afternoon. I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute here in Florida. We are at the end of the day. This is our 5th surgery. We've broadcasted 3. The other 2 are smaller cases we did in another operating room that doesn't have broadcasting ability, so we couldn't broadcast. But we did a SI piriformis last, and before that we did a shoulder DPR combined with a lumbar facet. This case, our patient travels from Canada. She's here with 2 herniated discs causing back pain that pinches the nerve going down her left leg. She also has a piriformis syndrome. We're going to do the discs first. We're going to repair 2 discs, L45, L5S1. She has spondylolisthesis, spondylosis, disc herniation, disc bulge, stenosis, radiculopathy, back pain, bunch of stuff, but all related to 2 discs. So here we go. Little injection. Did you already inject?
Yes, sir.
You can tell. In that case, we'll get started. If you have questions, feel free to ask. In the meantime, Henry, if you could show our audience our video on what are the 30 different major causes of back pain. Shot. I'm Dr. R. Duke Machen with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. You can see there are 30 different specific causes of back pain, including 5 discs and 10 facet joints. And it turns out all of those causes of back pain can be cured now at Duke Spine Institute, as long as we know which cause you have. So we are able to make that determination usually doing an MRI review, AP. The MRI review is done virtually over the internet through video conferencing on a platform called Zoom. And in a 10-minute Zoom call, I can diagnose your back pain or neck pain source, and I can set you up with a treatment that will work to cure your problem. In the case of this patient, she has back pain coming from two discs, the L4-5 shot and the L5-S1, and we're going to go in and repair both. Any possibility of discogram?
How are you doing? Hello? You okay? Can you open your eyes? How are you
Now,
doing? Okay, we're going to ask you a question, all right?
Now we know that based on where she showed me her pain was, and based on the MRI showing me there are 2 discs that are being damaged with annular tears that look like they're causing her back pain. So I made the determination these 2 discs are causing her back pain. And shot. So we're going to inject a little dye in, and we're going to repair both of these discs. Are you comfortable? All right. How bad is that on a scale of 1 to 10? How high does it go? You can see her arching her back. Is that a 10? I think she said.
Hello, how are you doing? Give
That's
us
a
a
10.
number. Did it
She
hurt a
said,
lot?
yeah, she said 10.
Okay, all right.
All right. So the L5-S1 was a 10 out of 10 pain. And you see she's relaxed now. She's not arching her back. We're not giving any dye into the disc. And we're just going to go ahead and inject. And you can see her coming up again. How bad is that on a scale of 1 to 10? How high does it go? 10? All right. So it went 10. Is that where you get your back pain? Yes? Okay. So concordant. Now, let's take a look at that x-ray. Jordan, show us the tear that's causing her back pain. She's got a really big tear. It's black. It starts right where the arrow is and goes out to the back of the disc. It's called a posterior annular tear. And that's the main cause of her back pain, right there. It's also pinching the nerve going down her leg, irritating that nerve, causing sciatica. So we're going to go use our laser to clean up that tear and eliminate her back pain. Shot? You can drop the table about an inch. The other way? Yeah. Good, that's good. All right. Any questions, feel free to ask. I'll do my best to answer your questions. But we're going to go ahead and place the dilator right now and gain access to the tear in the back of her disc.
At this moment, no current questions.
Thanks, Henry. shot. The surgery is done through a 7mm incision. That's 1/4 inch incision. And we go straight into the disc, right where the damage is. So we don't create any new damage in the disc, and we're not creating any damage in her body. We're literally just cutting the skin. So that little cut on the skin is all we need. It's the only damage we do. And we're going to go clean the disc so that it'll start healing itself after the surgery. Once the disc is completely healed, then the risk of reherniation is virtually zero. Henry, let's show the audience how these discs can be so painful for patients.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. You can see from our video how these disc injuries can become so symptomatic. It's all about inflammation going on in the disc. And this patient is here actually with her family from Canada. She came with her husband, who has also had back surgery here. And I can't give you any names or information, but I could just tell you that she and her husband both had surgery today. Her husband was earlier. He's already gone back home to the hotel, actually. And she's going to be going back to the hotel as well shortly after the surgery. You see the tear right there?
Yes, we do.
Sorry about all the bubbles, but the tear is right in front of us at the end of this tube. And that's the tear in the wall of the disc that the herniation escaped from, that tear. So the herniation never really got out of the tear completely. A lot of the herniation is stayed stuck inside the tear. And that's the herniation right there. That's what we're zapping with this laser. We're removing the herniation from the tear. This is a technique that I developed myself here at Duke Spine about 19 years ago. And I learned the basics of endoscopic surgery from my predecessors and teachers, including Dr. Sang-Ho Lee, Dr. Sebastian Reuten in Germany, Dr. Sang-Ho Lee in Korea, Dr. Anthony Young in Phoenix, Arizona. And these men were great surgeons, neurosurgeons, orthopedic surgeons, and they taught me so much about endoscopic spine surgery. But this part that I'm doing right now, the key to the surgery, they were so close themselves to understanding and performing, but they never did. They never understood that this tear is the source of back pain. I figured that out independently, and therefore I created the Duke Laser Disc Repair, which is a unique surgery that not only removes the herniation that pinches the nerve root like everybody else does, but it also cleans the tear, and we do what's called a debridement of the annular tear, which gets rid of the back pain. So we're able to fix not only leg symptoms, but also back pain. Any questions?
At this moment, no current questions, but we are getting a spike in viewership. So in the meantime, why don't we show the audience of how it is that we cure discogenic lower back pain?
Oh, I thought we did that. All right. Sure.
We showed how what causes it, not how we cure it.
Of course. Very good. Thanks, Henry.
Of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, welcome back. And she's doing great. We're working on the first of 2 discs. This is the L45. Not only does she have an annular tear that's painful and a herniation here that's pinching the nerve going down her left leg, which would be the L5 nerve root, L4 and L5 nerve roots, but she also has a second herniation at L5S1, along with the degenerative disc that's causing back pain and leg pain. We're going to fix that next. Finally, when I did my exam on her, I also found that she had a torn muscle in her buttock called the piriformis syndrome. And that muscle, the muscle tear, doesn't heal itself. It causes chronic lower back pain. So we're going to be doing her piriformis tear repair, or we call it a release, after this disc surgery. So if you stick around, once we're done with this stream, we're going to start another stream right afterwards, and that stream will be her piriformis release. Do you mind showing our audience how do these piriformis injuries cause so much pain, and how do we fix it here at Duke Spine?
I don't mind at all.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Duke piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Duke piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes, minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Yes. All right, welcome back. Now, you just watched our video on piriformis. And piriformis is a problem with a muscle that is in your buttock. That muscle is called the piriformis muscle. It runs from your tailbone over to the hip. And what happens is when you bend over and twist at the same time a certain way, which is a very common way of bending over and twisting, especially if your back hurts from a disc problem, then you actually end up tearing that piriformis muscle. And once it's torn, it never heals itself. It just stays inflamed and painful the rest of your life. So we've done all kinds of treatments over the years. We've done shots, Botox, stem cells, PRP, steroids. We did everything, and all those treatments are wonderful because they actually work, but they only work for a few weeks, and then the patient's pain comes back. So we developed a permanent fix for the piriformis, and it's called the piriformis release. And that's what we do. We actually go in and release the muscle off of the bone, and that stops the pain permanently, immediately and permanently. It goes away. And that's what we're going to do for this lady. We're going to do a piriformis release on her when we're done with fixing her discs. Any questions? Feel free to type your questions in the box, and I'll be happy to answer them. We are streaming live on YouTube, Facebook, X, LinkedIn, and Kick.
Kick and Instagram.
And Instagram. Nice. So we got audience from all over the place watching, and you guys are all welcome to ask questions. So we just finished the first disc. We're going to get to the second disc now.
We just got a question
I'll have happy to take it.
coming from Pawn Lust on YouTube,
Pawn Lust, sure.
asking, are there athletes, journalists, politicians, or other people in the public eye who had your surgery? It could be great marketing for you. I recently learned that Rush Limbaugh had spine surgery for herniated discs, and his pain continued.
Well, send Rush Limbaugh to Duke Spine. And then we'll have somebody famous that you can reference. Free surgery to a famous person? The problem about free surgery is that it's not free for me. I have to pay for it out of my pocket, literally out of my pocket. Maybe just a piriformis, like, you know, a cheap old surgery like a piriformis. I love it. I'll tell you what, Allie, you get everybody here to work for free for one day, and that day I'll bring in somebody and do free surgery. All right? Can you do that? No pay. Push pressure. All right? Everybody has to come and work for free. Besides me. Besides me, because I already work for free. Yeah, your side. Every single surgery person has to come and be willing to work for free. Sean? All right? Let's see how easy that is. The point is that surgery is never free. Even if it's free for the patient, it's not free for the people providing it. Right? So as much as I'd love to do Rush Limbaugh surgery for free, I'm sure Rush Limbaugh can afford to pay for the surgery. Is that her moving? Yeah. She's moving a little bit. I'll just wait. So we have had famous people come here. I've had billionaires. You guys have watched me operate on literally billionaires and world leaders, but I cannot disclose their names or anything about them. Why? Because it's against the law, number one, and number two, it's unethical. Thanks. Those type of people usually don't want anybody knowing that they're having surgery. So it is what it is. Yes? All right, we're going to move on to disc number 2, L5S1. Now, this is a difficult one to do. Hold on. Because she's got a very high iliac crest. I was having a little difficulty getting in there. You can actually see the angle here. The angle. So this is her spine down here, the disc, and I'm having to aim way up towards her head to get in there. But we're in. That's the good news. We're in. Not easy to do. This is a very collapsed, degenerated, scarred up, inflamed, chronically inflamed disc. But when I saw it, I said to myself, that thing's going to be causing symptoms, so we got to go after it. We got to try to fix it. because if I don't fix it, she's going to have symptoms still, and she won't be entirely happy with the results of her surgery. So we decided that we were going to go ahead and fix it. She wanted to get it fixed, and I felt it needed to be fixed. So we got in, and just so you know, there's really one surgeon in the world that can do L5-S1 almost on every single patient, transforaminal. That's me. All these new endoscopic spine surgeons, they have no experience, knowledge, ability to get into L5-S1 transforaminal. They try to go translaminar or interlaminar, which is really bad for the patient because it causes a lot more damage to their body. You have to remove bone and ligament. All right. Let's see what we can see here, folks. Again, we've got some bleeding because we're dealing with a very inflamed disc. Lots of inflammation means lots of blood supply. Lots of blood supply means bleeding. All right, here we go. By the way, this bleeding I'm talking about is minimal. It's no more than a few drops of blood, but it's more than what we normally see. So when I say lots of bleeding, it's relatively speaking. Any questions?
At this moment, no current questions.
So the answer is yes, we have famous people, but we don't disclose them, and if they want to disclose, they will. But in the end, I don't think most people want to talk about the fact they had surgery. I need to grab her again. It looks like there's a piece there that needs to come out, but it's not wanting to come out. It's making it difficult for me. That may just be inflamed wall. It's kind of hard to tell. Oh yeah. All right, any other questions? Look at that inflammation, my God. It looks like icicles, but all that is scar tissue and inflammatory tissue from years of inflammation.
At this moment, no current question.
Folks, we're going to be done in about 5 minutes, and then we're going to move on to our piriformis. So if you have questions, ask now. We're going to end the broadcast in a few minutes, then we're going to come back with our last surgery broadcast of the day. This patient does have a piriformis syndrome. We're going to go do a piriformis muscle release as soon as we're done fixing her discs.
We just got a question coming from Stuart on Facebook.
Hi, Stuart on Facebook. Welcome to our live stream.
Asking, hey, doctor,
Hi.
do you do anterior discectomies and stuff like that, or posterior cervical discectomies? Just curious.
So the answer is yes, I do. I am a neurosurgeon. I was trained at the top neurosurgery training program in the world. I did my training back in 1997 until 2004. And neurosurgery programs for training, the best in the world are in the United States, at least back in 1997. And the best neurosurgery program for training in the world was actually at the University of Florida in Gainesville. Top program. I turned down Harvard, Columbia, Hopkins, Seattle, the Barrow, all those programs basically to come to University of Florida and train under Dr. Albert Roten, probably the most famous neurosurgeon in the world. Dr. Roten built the top neurosurgery training program. So I left Los Angeles, California, where I did my medical school at USC. My mentor was Dr. Marty Weiss, chairman at USC. Dr. Weiss and Dr. Roten were very good friends, top neurosurgeons, both of them, in the world. And I was picked up by the University of Florida as one of their 2 neurosurgeons they trained. So during my training at UF, I learned how to do everything in the spine, from artificial discs to laminectomies, discectomies, posterior cervical decompression infusion, thoracic surgery, I mean, everything. Like literally from the best neurosurgeons in the world, to be honest. I learned instrumentation, screws, rods, cages, reconstructions. I learned everything. And I was a top trained spine surgeon in the world. And I did traditional spine surgeries, like everybody else, the top surgeons do today. However, I learned how to do endoscopic surgery along the way, and I basically shifted my entire practice and everything I recommend away from invasive surgery and now into endoscopic surgery. The problem with endoscopic surgery is that it's far less expensive to do than invasive spine surgery, and it's more successful. Patients do better, they get better. Rather than leaving the hospital with back pain or taking narcotic painkillers, they take 0 painkillers and they're out of pain completely. So it's a much better type of surgery, but the companies that make money selling screws, rods, cages, implants, artificial discs, all these devices, Intercept device and ultrasonic devices, all those companies that they make big money from selling things that surgeons put in your body, they don't like this surgery because they don't make any money. We're not putting anything in the body. It's an all natural repair of your disc. So the companies that run spine surgery in the world, Medtronic, Johnson & Johnson, DePuy, Alphatec, used to be Nuvasive, now Globus. These are multi-billion-dollar companies. They sell a $10 screw for your spine. They sell it to the hospital for $1,000. And they sell billions of dollars of implants every year. Boston Scientific, for example, is another one. And those companies don't want this surgery because they're not making any money from this surgery. And they control all the marketing and all the training and all the educational symposiums around the world for all the surgeons. So they are blocking this technology. That's why we're going straight to the public, straight to you, so you can see it for yourself and how much better it is than traditional spine surgery. But yes, there's no spine surgery that I can't do. I've done it all. All right, thanks for joining us. We're going to end the broadcast and we'll be back for